One of the things that we do also is that each one of our pharmacies submits their compounded Wiley protocol products for an analysis. And so that we do that on a quarterly basis. And what that means is that we know, without a shadow of a doubt, the potency of what our patients are getting. Again, so our physicians can be sure that that's what the patient, that what they wrote for, the patient is getting. And so it's not an aberrant response, it's actually a response to the dose that they have. Now, they also, one of the other safety mechanisms we have, that's basically part of our quality assurance, but we also have to be sure that our compounders aren't affected negatively either. So on a biannual basis, we have all those people that are compounding the product to have their blood levels and serum levels checked to make sure that they've not been negatively affected by inhalation or by topically touching the medicine. We see on a monthly basis gradual improvements in people's quality of life. They're always saying how much better they're feeling than they did before. And it's kind of interesting. Sometimes people, women or men, will plateau for a period of time, and they'll think, well, I'm going to go off of it for a period of time just to see if I really need it anymore. And it's just a matter of days before they're back in saying, no way, I need to have my hormones back. I did not realize how effective they were and what happens to me when I don't have them. So it's a real interesting point of therapeutics there, noting how effective they are, but also how short-lived it is. It's not something that's stored because the condition didn't go away. It didn't get better on its own. You can't start making hormones again when you couldn't make them before. It's a replacement therapy. It's not supraphysiologic doses. It's the fact that you get the right amount to the receptors that make it work. What happens is all the tissues have a receptor response, then it's an endpoint receptor, okay? And that just defines what the tissue is going to do. A breast has certain receptors for estrogen and progesterone, and that's where they work, okay? But if those receptors haven't been used in a long time, they can get overloaded. But then also, if they're abruptly, with the medication or the hormones are abruptly taken away, that receptor site has been now used to firing. And then you're going to see some very severe responses from that receptor site when it has nothing there to stimulate it. And that's when the symptoms all come back, and they come back with a vengeance. The best things that I see from the Wiley protocol response are women and men feeling good. Now, a lot of people will give me a lot of problems with that, saying that, well, we can give people a lot of things to make them feel good. That's not what I mean. I'm seeing a change in quality of life, positive. People can think again, people can laugh again. Their tissue feels, their muscle tissue, their skin tissue is alive again. Hormones allow us to interact with the environment, and people that don't have them can't. And by balancing that, you become more aware of what's going on around you. You can appreciate it, or you can do things to change it. And I think that's the best thing I see from the Wiley protocol. People becoming alive again.
As I read Sex, Lies, and Menopause, it just made so much sense to me. I've always known if I ever did hormones, I would do bioidentical. And at first, the idea of having a period again really freaked me out. I thought, well, do I want to go through that again? But the more I thought about it, the more normal it really seemed to be. And it's a wonderful way to turn back the clock. When the conference started, I walked in and they were sitting at the table, and we said hi, and she said, how are you doing? What do you feel? What's the main thing you feel? And I said, I feel really juicy. And I really believe that the best way to stay healthy is preventative. And don't wait until you have to have your uterus taken out to find out that you should have been having estrogen and progesterone in a normal cycle.
The most interesting thing to me, from a clinician, the obvious things that I've seen are significant improvement in bone density. I've seen reversals of osteoporosis and osteopenia and those sorts of things. But really what's been the most interesting for me is, and I'm not even sure I was really looking for this when I started using this form of therapy, but what I've seen is a large number of my patients coming back into the office and telling me they feel like themselves again. They feel more feminine, they feel like they're more connected with their surroundings and with the people that they relate with. Their sense of femininity is increased, and that's been remarkable. I mean, that's been such a remarkable change from what I was doing when I was using low-dose static hormones. My initial consultation is an hour, and I spend a lot of time talking about those things and talking about the difference between low-dose static hormones, which is sort of the standard regimen that's promoted by the mainstream, and then my 15 or 20 years experience with that, and then the last 4 years that I've had with the rhythmic. And then I try to weave in some of the physiology of what rhythm does, you know, the importance of peaking estrogens and peaking progesterones and the turn on and turn off of different things. And then I just sort of show them that my experience has been so much better in terms of trying to reverse some of the things that women are suffering. And so I focused more on that. And of course, I'll refer them to T.S. Wiley's books and to read if they really want to understand a lot of what's going on and that sort of thing. I think probably the most remarkable thing for me is, you know, when you provide health care for women and they come in midlife, they're looking for some sense of restoration of themselves. And I was unable to achieve that significantly with the hormone regimens that we use more mainstream today. So for me, when I come in and have patients that now tell me that they're more happy and their relationships are better and their view of their life is better, then that to me is amazing. And then things like reversal of, you know, bone loss and of course normalization of body composition and those sorts of things are just sort of icing on the cake. I mean, everybody's biggest concern is cancer, you know, and so because all the furor over hormone replacement and breast cancer and that sort of thing. So I spent a lot of time trying to clarify all that literature and what all that information that's coming out, a lot of which was just taken out of context and even before it was peer reviewed. So we spent a lot of time talking about that because everybody's afraid. Every woman that walks in my office knows they need estrogen, but they're afraid to take it because they've been told that it's going to give them cancer. And this is by their primary care providers who have seen them for years. So it's a lot of questions in that regard that we have to get by. Most of the disagreements that come out about this protocol is who started it. You know, she's non-credentialed, she's a housewife, she's whatever they want to say. But you know, my experience with TS has been remarkable. I mean, I've done gynecology for 22 years and I didn't really understand what I did until I came here. And then when I came here and started looking at the research that she had gathered, listening to her presentation and having her help me understand how the hormones really work, I wasn't as good of a gynecologist as I am today. So I think everybody should try to come and see this because, one, they would understand how brilliant she really is and how much, I mean, I describe her as a savant to my patients because she just has an understanding of this that a lot of people don't have, even people that are scientists that do this for a living. So I think you gather a lot of benefit from coming and listening for the credibility and the information. Plus, it's just a nice forum where there's 40 or 50 doctors in a room that have similar experiences from all over the country.